The coronavirus is certainly making an impact and taking a toll on most of the world. But third world countries, specifically those in Africa, cannot fight the virus and its economic downturns. The world has essentially been put on a lockdown, leaving many people unemployed, without food and shelter, and unable to protect their health. In order to stop the spread of the virus, people must help and support one another. It is important to understand how other parts of the world are being affected. We as a country are experiencing the highest death tolls numerically, but part of that is due to our population size. Luckily, we have the resources and equipment to help us better get through this crisis, and this is something we can be thankful for. But unfortunately, other third world countries cannot get through this unassisted. I feel that we focus primarily on the impacts that the coronavirus has on our country because we're a bit selfish in a sense. It is proven that the virus will continue to spread internationally if we do not come together to stop the flow. Therefore, it is important to become educated on the state of other countries. The lack of strength in many third world countries leaves them experiencing devastating losses that could have been prevented if they had had the economic stability of a country like the United States. Now I will move on to discuss and focus on the impact that COVID-19 has had on Ethiopia specifically. I think it is important to understand that the number of confirmed cases in Ethiopia isn't necessarily that high compared to other countries. What is most alarming about Ethiopia is the country's inability to properly protect its citizens. BBC News states that Ethiopia has declared a state of emergency despite Prime Minister Abiy Ahmed saying that we can't impose a lockdown like more developed nations, as there are many citizens who don't have homes. There are nearly 88,000 homeless people in Ethiopia. Many of the citizens are put in a very tough situation because they're unable to stay healthy on their own. Next, the AHA says that the World Food Program estimates 38% of children under the age of 5 are underweight, and additionally 46% of the population is malnourished. The education system in Ethiopia have stopped completely, and schools and university feeding programs are responsible for keeping the children fed, but without these programs, many children are undernourished. Almost 1 million students are negatively affected by this. Moving forward, I will talk about the impacts of Ethiopia's struggling economy. African nations have limited resources to replace the incomes of their citizens. These difficulties highlight the importance of testing for the coronavirus. 23% of the population lives on under $1 per day salary. The Ethiopian economy is not strong enough to support its homeless and laid off workers. Ethiopia is the second most populous country in Africa, but it is also the poorest, proving the weakness of their economy. The United Nations Economic Commission for Africa estimated that COVID-19 will shave 2.9 percentage points off of Ethiopia's economic growth for the fiscal year of 2020. It is almost a gamble to see which alternative will experience less deaths, whether it's by quarantining from the coronavirus itself or by sacrificing the health of the homeless citizens who are unable to support themselves because the government is unable to provide compensation for these individuals. Fortunately, a plane load of protective and medical equipment donated to Africa by a Chinese billionaire helping to fight the coronavirus arrived in the Ethiopian capital Addis Ababa on Sunday. This is an example of how generous and stable countries are giving assistance to those in need. The generosity will go a long way in slowing the spread of the coronavirus. Lastly, I will discuss the living environment of the citizens of Ethiopia. So obviously, Ethiopia's living conditions are very poor due to a lot of their economic troubles. About 70% of the housing units in Ethiopia require total replacement. Only 30% are in fair condition. Most of the houses are made with wood and mud, have cracked walls, leaking roofs, and dirt floors. About 80% of the capital is considered slum areas and characterized by widespread sanitation challenges. Families live in the crowded rooms and are exposed to health and safety risks. When you think about the act of quarantine, living in a small house with several family members is not ideal, especially given the sanitation issues. Ethiopia's main health problems are said to be communicable diseases worsened by poor sanitation and malnutrition. Over 44 million do not have access to clean water. Excuse me. These problems are exacerbated by the shortage of trained doctors and nurses in health facilities. With little to no clean water, how are these people cleaning themselves? How are they staying hydrated when they cannot just walk to a grocery store down the street and buy a drink? Ethiopia has had 74 confirmed cases, but millions more have been negatively affected by the economic downturn. In conclusion, we look to evaluate whether the country-wide lockdown is even worth the drastic repercussions that the coronavirus has had. Ethiopia is obviously a third world country that has been struggling for many years, but the coronavirus has pushed them even further over the edge. The government is not able to support their homeless like we do and provide them with extra amenities and shelter. For those who are unemployed, the government isn't able to offer any kind of work compensation. It is almost doing just as much harm to quarantine people. It is due to these living conditions, it might be worth operating as usual. Even though Ethiopia hasn't experienced a lot of deaths, the virus is taking a major toll on their economy and well-being as a whole. Excuse me. We need to be aware of the effects that this virus has on other parts of the world and be grateful for the care and aid that our government and health officials are able to offer to improve the living conditions in Ethiopia and help prevent contagious diseases like coronavirus from spreading. Consider donating to Habitat for Humanity to help raise money to build new homes for those in need. Thank you.